All right, see, talking about some key fundamentals in gynecology, that's basically things that help to keep the gynecology practice, you know, well and all of that. We're talking about what is known as a cultural competence. Cultural competence, you know. So cultural competence in gynecology is, you know, the ability of the healthcare providers to be able to deliver respectively effective patient-centered care to individuals from diverse cultural backgrounds. So the thing is this: if you find yourself being practicing in a place where, you know, the people's way of doing things is different, you try to learn about them, you try to behave like them. If you're in Rome, behave like the Romans. So it's not just about knowing customs, it's about understanding how culture shapes health beliefs. So you are trying to explain something to a patient, and you deeply know that, okay, this patient, their culture is like this. You know, learning about that, it can help you to be able to now, you know, maneuver around explaining stuff to that patient. All right. So why does it matter? It will build trust and improve patient-provider relationship, enhances communication, especially around sensitive topics like contraception, sexuality, and fertility. Alright, so it actually enhances communication, especially around sensitive topics like contraception, sexuality, and fertility, because different cultures have different ways in which they approach these sensitive areas, you know. Reduce health disparities, improve outcomes for marginalized groups, right? Encourages adherence to treatment plans when patients feel understood, all right? So key practices for providers is: ask, don't assume that all people are the same, all right? Use inclusive language, offer interpreter services, respect modesty and privacy, involve family when appropriate. So sometimes when it's getting out of hand, you have to involve one or two people to mediate you and the patient, you know. Common cultural consideration is modesty. So patient may prefer same gender providers sometimes, you know. Religious beliefs may influence view on contraception, abortion, and fertility. So you have to actually learn the ways of the people, okay, when you find yourself among them. Traditional medicine. Patient may use herbal remedies, spiritual practices alongside clinical care. Communication styles. Some cultural values indirectly communicate. They value indirect communication or deference to authority, you know. So you have to be calm around, just know, you know, you just have to, it's a concept that just have to do it. You are trying to know the environment where you find yourself as a healthcare provider.